So I think the
Okay.
Essen will have around 30 to 40 minutes to present the solution in English. So the audience, you can ask the question, just put on the chat box. I will try to translate to Essence, and then please, you can also use Bahasa, no problem. I can translate to Essence, and then after that we do the Q&A session, yeah, around 10 to 15 minutes, yeah. Okay, I pass to Essence. Please share your presentation. Yeah, thank you.
Thank you for having me here. And hi everyone, this is Essence from TPI Software, as you probably already know. And today I'm going to share some of our findings in recent smart health market and how it has been developed and its future and how its future. In year 2020, there was a report saying that in another 20 years, by 2040, all the healthcare is going to be highly rely on the large open data and communications and all the interoperability data and the secure platforms. But when the report was released, it was year 2020, but now almost 3 years later, it's already like everyone is relying on mobile devices and turn to smartphone or other health devices for healthcare or for telemedicine next, please. So today I'm going to cover 4 topics. And the first one is how the market is growing now, and also the other initiatives that is being taken in some countries or by the authorities. And then we are going to look at some of the challenges and difficulties current health institutions are faced with when they trying to move to smart health or proceed with their digital transformation. And then I'm going to share some of good solutions that is ideal for those health institutions. By year 2032, the market is going to grow like almost 5 times. So meaning that in big data or cloud computing or other connected health and the mobile health are going to grow and going to release more service with innovations and with other integration services. And one of the key reasons is that more and more healthcare professionals are turned to mobile devices and adopting technology such to provide their healthcare and health services next. And not only that, more and more people are also getting themselves quite familiar with using mobile devices for making appointments or consulting medical people. And not only that, because of the APIs and its API-driven innovations, more and more software applications are released in order to help people to manage their health or to monitor their habits or their daily exercise. So next, so when people talk about smart health, we do know that there's a pivotal point that moving everything forward so fast. It was COVID-19. Before COVID-19, the market was growing, but it's not that dramatic change. But after COVID-19, everything has been pushed to contactless, to go telemedicine, and to go the remote consulting with remote medical consulting. So when we talk about smart health, what are smart health actually is? It actually has it has some features or characteristics. When we talk about smart health, it's specified like the service of connectivity, meaning that maybe your laptop or your mobile phones all the services are connected to each other and can be provided and broadcasted through those devices. And it doesn't matter which devices you are using, and it doesn't matter which operation systems are supported in your devices. And the second one is the interoperability, meaning that all the communications are device independent, and we don't have to worry about whether whether the service is provided in Java language or in .NET. And also there's another one is security and the privacy. Since open APIs push for more open data oriented service, there were a lot of concerns regarding to users and to its sensitive data and how they protect patients' data or other users' data. The last one is personalization. It's about how medical service can be personalized based on you as an individual, by your history, by your habits, by your eating habits, by your sleep habits, or by how much you exercise and how much you work. So it's more personalized, and because of open API, and all the data is more accessible and open to different business and different medical areas. So the professionals can actually do more analysis and prediction based on people's personal habits. When we talk about smart health, there are some key trends that smart health is definitely would dip in. One is patients engagement or users engagement, and there's the second one is telemedicine. So it's also cover not only just to go for contactless medical service, but it also refers to diversity and the inclusion of service of medical service. And then they are going to use a lot of AI technologies and machine learning algorithms in order to provide more precise or more accurate predictions or reports for different groups or different individuals. And then it also covers health information exchange. So which means like the fire protocol, everyone, all the medical institutions needs to comply with a certain spec in order to keep all the medical data in a consistent and a uniform formats, so that those data can be exchanged freely between different hospitals and institutions without extra work in order to getting the medical data interpreted. And then there's like well-being and biosensing, like Fitbits and all the wristwears, usually to monitor your how many hours a day that you have been standing, how many hours a day you have been sitting at the desk, and also your heartbeat or pulse or something. And also we have the home care, most of all, it's cloud computing, because without cloud computing, all the data cannot be communicated, cannot be transmitted. So that's other key trends for now. And apart from, we can also see after COVID-19, many countries and governments have been pushing the regulations relating to personal health care, and to have all those bills or regulation passed, and in a quite faster pace compared to the past. And as we know that, like in Indonesia, during the COVID-19, the Indonesia health authorities has released the app, and the app was to provide like proximity information to whether you are exposed to certain COVID people, or just to see like all the information about COVID and to check. And after the COVID was put down in Indonesia, the government and the authorities just took another step forward. They transformed this app into a platform, and the platform is mainly for now is mainly for medical record platform. So lots of hospitals have integrated with the platform by giving medical records and by using the same one consistent APIs specs, so that the authorities actually has one centralized pool for all those medical records platform. As far as I know, that up to last year, it's already 1,000 hospitals in Jakarta area have successfully integrated with the authorities platform. And now in the end of this year, it's targeted to have all the hospitals to get integrated with that platform, so that all the medical data from of the Indonesian people can be logged onto the authorities one centralized platforms. So it's, in a way, it's actually an patient-centric approach, because for now we are seeing the data are being collected. But with all this data collected for the authorities and for hospitals, they can share this data. They can further analyze this data. After the analysis and with other design and further innovation, we are able to provide more patient-engaged services, or to improve any of the process during the medical visit, or just to ensure that some of the cons or the weakness of the medical service in the past can be enhanced. So in a way, it's just focused on people right now for all this medical service. And also, there were information saying that during the COVID time, many medical professionals or nurses and doctors rely on app or other technologies only to check and manage their medical supplies and facilities, so that they could just keep the control and always keep the inventory under the safe quantity, so that they could better handle the situation during the critical time. And so the reason that many business or medical institutions are going for digital transformation is that they do have a lot of advantages. One is that the hospitals and the patients themselves can get real access to patients' data, and they could be able to come up with some decision when the situation is dire, and also personalized health care can be further enhanced. And then, of course, with all the big data and the cloud computing, and also 5G, the advanced healthcare is expected to dominate the market soon, because the big data bases are getting larger than before, because you can share the data, and all this medical data are in consistent formats. And then, of course, hospitals are able to provide better service, or have the patients to have better experience during the medical visits. And also, diversity and inclusion in healthcare is always a key and a priority. And so in a way, hospitals and administrations trying to look up ways to reduce their operation costs, and to go paperless, and to have all the assets and medicals to go digitalized. So that's the benefits of going digital transformation. However, with all this advantage, it's not easy just to retire some of your systems and just build the new ones, because legacy systems do exist for its purpose and for its value. And there are also challenges if you want to replace those legacy systems. Next, please. So what are the challenges? If you want to replace a system, you have to do the evaluation or the revaluation. And for hospitals to do the evaluation to assess how much work to be how much work will be needed to replace certain systems and to rebuild the new one. It already costs them. It just costs them a lot of money just for the evaluation. So for them to try to reduce the cost, they have to pay the cost first. And then there's another one is technical specifications. The legacy systems are built in a programming language that may be no longer supported or available in the markets, and you may not get right persons or no more expertise in the hospitals or in the markets can understand those systems. There's a large gap to do the migration, and also there's a resource shortage in terms of technology, because technology, even if there's the technologies are booming and we have all the cutting edge technology, but there's still a lot of gaps and a lot of legacy systems that cannot be connected, cannot be just export with current technology. So it's really a pain for the hospitals and the healthcare service providers. And then it's about data protection. We have to export all the data from the system, and we have to make sure that the data exported are actually correct. And we also have to make sure during the migration, nothing is lost. And during the migration, all the sensitive data are well protected, and there's no vulnerability or security breach to the data being exported. And then there's the user experience that administration needs to consider, because the users are already familiar with the current systems, and they may not be understanding about why the system has to be replaced at this moment, and they may have some they just feel reluctant to participate or something. And also, in order to have these users to be more positive and to be embracing for the new system implementation, you need involve some of them, the key persons, or maybe many of them, to share their opinions about how the new system should be built. So in the end, you see, by assessing the replacement and by assessing how much work with data migration, and also what should be done with the new system, it just costs the hospitals more before they can actually get started with the system. So that's the challenges right now. And the next, and when we now talk about digital transformation and building the new systems, it mainly means that all systems or the current service will be built on a platform or on a service that will be always ready to go cloud. And also, all the service has to be work independently of each other. However, they could communicate with each other with APIs, so that the whole system can stay agility, and it helps with the new enhancement or features, because we don't want the situations like when you add one more feature, you have to stop the whole system. So that's a big taboo in providing new systems to hospitals and to all those service critical business. So now the mainstream is, of course, we have to help our customers to go from monolithic design to microservice design. But when going from monolithic design to microservice design, it could be another challenge for our customers, for the hospitals and the IT, because there's a chance that they are not familiar with microservice design, and they are not familiar with why the microservice design matters when they are going through digital transformation, and why it matters for them to provide connectivity and to provide always on service to their patients or to their customers. So in the end, due to the natures of microservices, it's the best choice for hospitals or healthcare service providers to build their new system, because the microservice has a couple of advantage. One is that it's quite flexible, and as I mentioned, you can add new features while you don't have to shut down the system. That's one good point. And there's another one is with microservice design, it allows the systems to communicate among all the different modules by the frequency of the service, or by the complexity of the design. And also for now, all the service and all the APIs are blooming. So you will need to adapt your system to the markets instead of have the markets to adapt to your system. So turning to microservice is the only choice our customer have. And also with microservices design, you have to consider about API gateway. You have to consider about how the APIs are managed across the system, also with external users. And also you have to consider about the load balance, the traffic. What about how the system is going to handle the peak time? So all these questions are the hospital staff are going to answer or going to work on. So apart from digital transformation, build a new system, they have to deal with all the technology that they are not familiar with. And also for the legacy systems, they have to worry about how they are going to understand the old system logic and the pattern and design. So it's not just you can finish in a snap. It's a whole package that the hospital staff needs to consider. So the key technologies are going to use. For me, I would just look at the 3 dimensions: by design and implement. We go for microservice and the containerizations, so that you will going to have a system that can go scale up and scale down as necessary, without you having to reserve resource beforehand. And in terms of service provision, or we say the deployment strategy, we have to go hybrid. Go hybrid means that the service you are going to provide will be through one of the public clouds, but there's a chance that you have an ecosystem with other partners, so you have a community clouds. And also due to some data sovereignty issues, you have to keep certain data in your country, in your IDC. So hybrid is the only option, and you have to make sure that all the service can deploy in various public cloud, not just one. And so that's key technologies that you need to consider. And also the integration, as we just emphasize again and again about the legacy systems. Not only you have to export the data, you have to make sure the data are export correct and can be taken in by new service, and all the data or APIs are still meaningful. So it involves data transformation, and it involves that heterogeneous formats needs to communicate with each other. So with all the difficulties, I do think, or our company do think, that we need to come up with a solution that still keeps our customers in competitive in their markets, and not just stay the same level. We hope that our customers can rely on the solutions that keep them growing and keep them sustaining large traffic and increasingly growing customers' requests. For us, we've seen that a good solution for our customers to deal with digital transformation has to make sure that the solution can provide serviceability to our customers. And also the solutions has to comply with our clients' business corporate governance policies and the rules. And also it has to guarantee connectivity no matter which devices the service has to deliver, or no matter what programming language or framework is used. And also security. It's always the first priority, no matter in what business. So we have to make sure that only certain people, or the legitimate people or group can access the data granted to them. And there's another one is scalability. Scalability is similar to serviceability, but without scalability, meaning that when you expect high peak or high traffic due to certain events, such as a popular doctor that everyone would just makes appointment with that doctor, so that could cause the high peak traffic during certain time frame. So the system has to have the mechanism in order to survive that high traffic and to sustain that high traffic and not to crash the system. So seeing that, we do see the iPaaS, the integrated platform as a service. So it focuses on enterprise architecture integration, and iPaaS solution would be ideal for our customers. Let me explain in a simple example. It's a design. It's a system design and without an iPaaS. We just look at the color, the green color, and we have for 3 layers. We have front end service, and we also have the application middle platform, and also we have the legacy and the hospital management system layer. So if without any iPaaS, you just have another system and you just rebuild the systems, and that's all. Because and you with the APIs, you know that you are going to have a fire compliant APIs, but in the end, you still have to deal with the blocks that I put the question mark, login and the single sign-on on all the security and some of the mechanism that is always a necessity for systems. You have to work on them all over again whenever you have a new modules, you have a new features, and when you test these new features you newly designed, you have to test with all this, the login, the single sign-on, the security, and the ID and authentication all over again. Okay, so you can only, so without an iPaaS, you are going to do a lot of extra work in order to deliver your new service. Yeah, it's quite colorful. So if with an iPaaS, and an iPaaS would helps our customers to build their own microservice systems. And with an iPaaS, if you look at the pink and orange, pink color, that's the iPaaS value when you build a new system with microservice architecture. Because as I mentioned, that with microservice, you have a lot of APIs to handle, and you have to deal with the traffic, the load balance issues, and you have to deal with you have to deal with the security issue. You have to deal with authentication. But with an iPaaS, it's that a proper iPaaS should be able to take care of all this for our customers. For you, you don't have to worry about whether I have to do the authentication, and I'm not, and our company is not good at the authentication testing, or whether you have to figure out how to do the work, the third-party single sign-on, and you don't have to worry about how the load balance and the traffic, how can I properly distribute all the peak traffic, because you don't have to worry about that. And it's all package, it's in all package that an iPaaS should be provided to you. And also, if you look at the second pink color, there's a data transformation and the integration and the local API orchestration. So if without an iPaaS, you have to figure out how to do the data transformation, say from an Oracle ERP and to a newly designed microservice architecture ERP. Or also you have to think about how to export certain T24 ISO formats into a new billing systems. So without an iPaaS, you have to work them out by yourself. But with an proper iPaaS in place, the iPaaS should be able to deal with all these issues for you. And so even with you have some SAP or other EMR all systems, the iPaaS should be able to help you to understand and help you to extract the legacy data and to transform into a meaningful data for your new systems. And also, we know that Fire has also the spec based on RESTful API. So it could be very convenient for Fire APIs to talk to each other. But when you have a Fire API, but you need that Fire API, and you also need another API from your legacy system to be added to the Fire API, and to have those two APIs to combine these two APIs and integrated them and to deliver a new different service. In that case, if your iPaaS cannot make that for you, then again, you will have to deal with all the data migration issue and the data accuracy issues on your own. And proper, an adequate or resourceful iPaaS should be able to deal with that for you as well, so that all your limited resource can just be focusing on your service, your healthcare service, to design your innovation innovation that you want to deliver to your patients and to your community. So that's the beauty of an iPaaS that we think our customers, our clients can benefit from. So to sum up that an iPaaS key capabilities for any business who are going through digital transformation is the iPaaS should include an API service management modules, and should also include the service and the protocol integration modules. That's for legacy system. And it also has to include authentication modules, so that none of our customers has to do the identification, authentication, integration. Okay, and there's not a service and a service development framework. So that's for our customers to manage and to plan their microservice strategy. And also it has to the iPaaS has to support the multi-cloud strategy, because we already know that for all the business, one single cloud strategy is not gonna work, and because they don't want to deal with the vendor locked issues. So multi-cloud would be a mandatory or necessity for all our customers. So your iPaaS solution has to be able to support multi-cloud strategy, and also SLA guarantee infrastructure. By saying SLA guarantee infrastructure, I did not mean that if you have a service to build on-premise solutions. I'm saying that when you have both service on-prem and also in the clouds, you also have to make sure that your customers are not going to experience any downtime. Because for health or for banking, that any downtime is it's not acceptable. So you have to make sure that your iPaaS can guarantee SLA 100% by AP service, also by API services. Both of them are very important for your business. Okay, so that's the key capabilities. Okay, so with an iPaaS like this, what can you expect like 3 years from now or even 2 years from now? I think every of you is quite familiar with XaaS, it's everything as a service. So we are now working toward that everything as a service. So I do think that iPaaS is also an enabler to health as a service. That's an illustration, a simple illustration to show that how an iPaaS could enable hospitals or our healthcare service providers to build their own ecosystem with their partners, and not just vertical partners, but also some maybe pros. And so it could help our customers to build channels and to build the communication with the multi-cloud strategy iPaaS. So you're seeing that from the left side, left corner, you can see that there's also medical institutions, but they need some service. It could be that they are under facilities, or it could be they just seek third parties' opinions. So they could just check we say a medical care cloud, and they could just go to the cloud and to see what are the available service for them, so they can just pick up any of the service that they need. And also move on to the right side, you can see that there's some medical service, maybe the diagnosis or DNA testing or reports or blood test or something like that. So that's the service, the domain service will be put to the medical cloud by a group of hospitals, and they are sufficient in the equipment to do all the testing and to provide all the service to whoever need them. So for me, it's quite straightforward and quite simple to concoct an healthcare ecosystem within iPaaS. And players could be the banking or payment providers, and of course the vertical markets vendors will be certainly the players, and other ecosystem channels like a cloud service could be the channels, because you need a cloud to host your service. And also, of course, the domain service providers, the main domain service providers will be in the game as well. Yeah. So that's how I actually picture it as an iPaaS enabled healthcare ecosystem. Okay. So, but frankly, that's my presentations. Not sure that anyone has any questions.
Okay, thank you, Essence. I think there are some questions already. Yeah, let me try to see the question. Yeah, there are some question in Bahasa and also some question in English. Yeah, I think number one is from Dr. Sri Rezeki. She asks about does ever medical college understand digital health? This is interesting. Yeah, I mean the medical college understand the digital health. What are the aspects and policy and its potentials in the future? I think there are some also in your slides, right?
Yeah, but mainly there's another for the colleagues for the medical professionals, right? Because the medical colleagues or the medical professionals, whether they understand the smart health is the question.
Yeah, I think the current condition in Indonesia, the medical college, sometimes they don't really have a specific class or the specific major related to the digital health. Yeah.
Oh, okay. But
I think you can share your experience. I think you can share also the experience in Taiwan.
Okay, so from my experience in Taiwan, for sure, all the practitioners, nurses, they have to be certificated. But in terms of the smart health, it has to come back to the authorities and how they are going to set some regulations based on how the smart health technology is used. Like GDPR is one of the example, right? We have to, because GDPR applies in all domain, no matter in banking or in your workplace or in business or in hospitals. So in a way, it does it does reflect the scenario situation that whether the business and business policy align with the authorities plan or the blueprint for the countries and for the future, the upcoming 3 years or so. Yeah, that's how I see it.
Yeah, interesting. Yeah, I think there's also a challenge. Yeah, in Indonesia, I think we should have a digital health major related. Yeah,
and your country is quite large.
Yeah. Okay, the next question from Pak Muhammad Wildan: how you comply with the medical record data? The platform, how to comply? How the platform comply with the medical record data, especially the medical record data in Indonesia?
To have them comply, it's from my up to my knowledge up to now is that the everything has to go back to fire, as far as I know, because fire is now the priority, and it's I know it's according to the research I found, is it's more secure than HIPAA and more severe than other than the past medical protocols. So and from the fire, as I understand, it has explicitly specified how the APIs, by the APIs should be documented. So it's based on a RESTful API. So that's the first thing. And then the second one is, if that's based on the RESTful API, so the data formats and the communication protocol would be no problem. And then whatever data has to be communicated with HIPAA, like your health reads from your Bluetooth devices. Okay, if you want to send it back to the hospital, the channels has to be encrypted, like in JWT or JWE. So in terms of the security, and in terms of security, and in terms of the encryption mechanism required by FHIR, our solution, our iPaaS solution, is actually an open banking compliance solutions. So in a way, in terms of security, we are quite confident in complying all the fire related protocols and aspects. So
I think the global standard should be okay to comply but for the Indonesia medical records standards, I think there should be no issue because you have a RESTful API that can connect, right?
Yes.
Okay, the next question from Pak Eko Setiaji. Pak Eko Setiaji, let's see Pak Eko Setiaji. Is it true that the integrated and centralized API will only give the benefit for the specific party only? What do you think about the use of the blockchain's database?
Oh, okay. Blockchain is another topic, and for me, if from my personal perspective, it does not conflict. It does not conflict like we have the blockchain, because what blockchain trying to achieve is you make sure that none of your medical devices, none of your medical records are changed, and then none of it can be changed, and that's one thing. But if compared to our product or our solutions, we do have the request to ask us to provide something like a blockchain-like solution to make sure that none of our data can be changed and can be modified. So we do have a specific mechanism to deal with that, and it's not just about the encryption, because we have several patents, software development patents, innovation. So our R&D capability is quite strong. So we deal with that issues in an alternative methods by providing the same results. The reason we do that is that not all the parties are able to be in the blockchain. Okay, so if you don't have a chain, even you have the technology, so it's not practical for now. I mean, yeah. So that's how I see it. But for sure, blockchain matters, and it has its purpose in the scenarios that actually requires blockchain.
Yeah, I think that's also a new challenge, because the use of the blockchains also, I think that's also interesting to be discussed later, yeah. Okay.
Yeah, because
Okay, the next question again from Dr. Sri Rejeki. What is the digital information in healthcare? What are some examples of the benefit for the patient, of the digital information in the healthcare industry? I think there's also some in your slides before.
Yes, for the benefits, one is that the contactless medical visit is one. I think it's the best benefit up to now. Yeah, and also the telemedicine, because as far as I know that now we can go dental visit just in our home, at our home, with camera, with all the health technologies. So that's all the benefits for the patients, because it saves you from the travel. It saves you from just go to, maybe for some people it took quite a while from his home or her home to the trip. The travel will be too long to travel to the hospital, but they still need the medical service. So I think that's how I see the patient-centric approach. So it includes everyone, not just special, not just privileged someone to get that treatment.
Yeah, I think there are some benefit that I think also some in Indonesia hospital industry, they already use some applications, and I believe that in the background they should use the approach like this API, I think, but the different I think your solution is more on the iPaaS. That's why this comes to another question from Pak Farid Ahmad. Pak Farid Ahmad have a case that hospital in Makassar. Makassar is another city, in the East Indonesia. Requires data from Taiwan, Singapore. Does it provide API to retrieve the informations on the both system, like the SaaS-based? How to access the patient history if the data is connected to the hospital in Makassar? I think there are also some using the RESTful, right? But how they can use your product, the TPI iPaaS?
If you want to put it's quite simple. We just have the product set up, and you have the APIs registered on our product, and the APIs can just talk to the parties in our country or in Singapore, and they are already be able to get data. So as simple as that.
So it means that each hospital need to be connected to this platform, right?
Yes, it has to be connected to the platform.
And this platform can be on the cloud or on premise, right?
Yes, both are okay. Yes, both are okay with us. Yes.
Okay. I think that's hope answer the question from Pak Farid Ahmad ya. Silakan teman-teman yang lain apabila ada pertanyaan silakan ya. I think another statement from Dr. Yusuf, Pak Chandra, Pak Santoso Ujang, they're asking for the materials ya. I think you can also see the slides and presentation on the YouTube channel Event Cerdas ya. Silakan nanti bisa lihat di YouTube channelnya Event Cerdas. Kalau nanti perlu banget materinya, nanti bisa kontak ke tim Event Cerdas ya. Silakan ada lagi teman-teman yang mau bertanya, secara langsung juga boleh. Silakan kalau ada yang mau bertanya secara langsung, you can also just open the mic ya. Jadi you can ask directly to Essence ya. Ada teman-teman silakan kalau ada yang mau bertanya. Ada? Oke. Kelihatannya belum ada nih Essence. I think no other question ya from the audience ya.
Okay, so thanks for having me here, and if there's a chance, I would like to share more and to hear more about your markets and how the hospitals are going through the digital transformation and how the authorities deal with it. Yeah, because we do think that Indonesia is now quite a good example to see that just initiated by the authorities to have the patient-centric medical services to its people, but there's quite a long way to go. So we do think that integrated solutions that that covers all the security or encryption and all the audit tasks for our customers would be a wise choice, so that you can focus on your patients, focus on your service and innovation along with your country.
Yeah. Thank you again. Thank you, SNSU and TPI software team to able to share about the materials, how we are riding the wave of the healthcare industry, and we learn a lot from the TPI software.
Terima kasih atas narasumber kami. Thank you, Ms. Essential from TPI Software for sharing and discussing today. Thank you, Pak Funky, for being the moderator. And also thank you para peserta yang sudah meluangkan waktunya untuk hadir di acara webinar kami siang ini. Sampai jumpa di acara webinar kami selanjutnya. Stay safe and God bless.
Terima kasih semua. Sampai bertemu kembali.
Thank you.
Thank you everyone.
Thank you,
Bye-bye.
Chris. Thank you,
Thank you.
Agency.
Bye-bye.
Thank you.
Thank you.